Hi, I'm Dr. John Hatch, and I'm here at my clinic called Brain Rehab. And most of you, when you think about brain rehab, you're thinking of, oh, this is a lot of work. And the answer is yes. Movember is not just about mustaches. It's about rehabbing movement functionality. And when people say it's all in your head, they're absolutely right. Your brain controls everything that happens in life. There's nothing your brain doesn't control, whether it be hormonal instability, gut function, sleep, emotional trials, struggles, whatever you're going through, your brain controls it all. And what I've done for the last 9 years in clinical practice is rehab some of the most severe cases I ever came across. And whether that be vertigo, dizziness, this year alone with COVID-19, we've seen over 60 patients come in with debilitating suicidal thoughts, emotional distress, anxiety, that wasn't there before, and they didn't know why. Why would a brain go from everything's normal, world goes chaos, but you don't, but now you as yourself feel uneasy, unstable, and feel like you're not productive, or you've lost motivation, or your fatigue is hit at the highest level? It's because of your brain. Everything that we've studied in neurology, as a chiropractor who did a postdoctorate degree in functional neurology, my world that I live in is not just rack 'em, crack 'em, change, make some adjustments to structural things. I did postdoctorate degree in rehab of brains at the highest level and figuring out how this all works together. Norman Deutsch coined the phrase a neuroplastician. And if I was to say I do anything, I'm a neuroplastician in rehabbing brains imbalances. When there's been a concussion untreated, the number one side effect of a concussion is not headaches, not vertigo and dizziness, it's anxiety and depression, and it's just a ticking time bomb if the brain never changes. And when you don't have movement, your brain declines. And since this is about men, and I'm a man, I'm here to tell you that though you like to think that you're stronger, better, more intelligent than your incredible wife, there's a reason that this brain in my clinic shows one green area. Just so you know, men, this is the only part of your brain that's superior than a woman. Every other part is more developed, higher functioning in a female brain. It's also why they deal with more anxiety than we do, because they have more circuitries working differently. This parietal lobe is your sensory. It's your movement. So as a man, if you're not moving physically, structurally, our brains deteriorate way faster than if a female doesn't move or does move. That's really important. Now the question is, well, what type of movement? I exercise every single day. I go on walks. I go on CrossFit. How often are you sitting at that desk? And what are you doing while you're sitting on the desk? If you haven't noticed, I don't sit with a back support at all, and I sit at this chair for over 8 to 9 hours a day. I have no back pain. I have no hip issues. I have no structural pain or neck stiffness, and I stare at a giant screen TV every single day. Why or how? Because what you don't realize is I've been sitting this whole time on an aerated disc. And you might ask, what does that have to do with anything? When I sit on this disc all day, every day, I'm getting constant feedback to my brain. I grew up in Northern California, have surfed since I was 5 years old, and when I was a young kid, when I was stressed, angry, frustrated, I'd go surf and I'd sit in the ocean, wobbling back and forth, and get out of the water and feel like I had the best day of my life. It wasn't because I caught the best wave or something had been just epic in the ocean. It was the fact that I was giving feedback to my brain. Most of you with chronic back pain, chronic neck pain, sitting at a desk, computer programming, whatever it may be, what are you doing movement-wise? I know we talk about standing desks. We talk about ergonomics sitting on a Bosu ball. There's more to your brain than just a little bit of movement. There's also specific movement to your brain that can make the greatest change. And as I have seen patients from all over this planet travel in and come for a week intense to see if we can improve the brain, the biggest change is what you do at home, day in and day out. The brain, the ability to sleep. If you guys want to know what's the most important thing other than movement, is sleep. If you're not moving, you're not sleeping. If you're not sleeping, you're not suppressing unwanted thoughts. I repeat, if you're not sleeping, you cannot suppress unwanted thoughts. It's a new research paper that was just published this October 20th of this year, that your ability to suppress unwanted thoughts has to occur when you're getting correct sleep. So ask yourself, are you sleeping? And then why aren't you sleeping? Usually people aren't sleeping because the brain can't calm down. They can't turn the mind off. Well, what are you doing to turn that mind off? The mind actually goes all through the night. That's the frustrating part. It's like, well, how do I win this? The more you activate specific pathways in your brain, specifically your cerebellum, and that green part of your brain called your parietal lobe, you can develop and advance far greater than ever before. It doesn't matter what your genetic disposition is, or you're predisposed to this or this or this. You can change anything. A brain is moldable, it's plastic, it's changeable. So just because you say you can't teach an old dog new tricks, yeah, you can. I change it all the time. It just takes longer, or it's more efficient. I see so many patients with Alzheimer's or dementia or debilitating anxiety where they can't get out of the room, or an OCD where they can't go through the door because they have to check the handle 7 times. This is all inside your brain and how the circuitry is working. And when you stare at a screen and your eyes are tracking the way that they do, and the input to it, it's not the screen time. If it was the screen time, everyone at Adobe would be struggling and the company Adobe would be rough, okay? It's not screen time. I am here as a functional neurologist telling you it's not about screen time. It's about movement. It's about activation. And it's the more you activate the brain, the better, okay? The more you activate the brain, the better. Now the question is, what can you do at home? There are many exercises that you can improve on at home, and I can give you a few of them right now. One of the most complex brain exercises is simply anything cross-crawl, right? We learn of cross-crawl taps, right? Or cross-crawling for kids in development. Well, why aren't you doing it? Your brain's just as important. I have found that if you do cross-crawl taps, adjust your wrist and your ankle, you can decrease motion sickness, panic attacks, dizziness, general anxiety, and actually get your brain working. If you guys know, you guys work at one of the elite companies on this planet, right? More people probably know your company than anywhere else, definitely more than mine. And this system of your brain works on the higher executive learning. How many of you feel like you've hit a plateau in your career? You're not developing, you're not taking yourself to the next level. You do that with brain activation. You do that with newness. If you do the same thing every single time, research shows that your brain starts to decline. So if you come in and go into work and do the same routine every day, all day, your brain will begin to decline. That's why we as men, we like routines. But routines aren't good for us, man. We need change. We need shifting. So you women, make your husband do something he's never done before. Go get that pedicure. Go get that massage, couples massage. These are things that challenge a man and go, oh my goodness, I don't know if I can do that, right? And then they might fall in love with it and want it more than you. But more importantly, it's about movement and activation. So the more you move, the better your brain gets. And I'm not saying move just because it's Movember, but neurological movement, feedback to your brain. Cross-crawl taps, ultimate. You guys can all sit at your desk on your Zoom meetings, having a talk and rehab your brains. None of you should be sitting on a back. You could be sitting at a desk computer and sit on a Bosu ball and improve the constant movement to your brain, and watch what happens in 3 to 4 weeks. 3 to 4 weeks from now, you'll see a 50-60% decrease in that overall general anxiety. It's about movement. It's about change. And I have treated well over 6,000 anxiety cases. Most of them, 11 to be exact, have only taken longer than 3 months. You activate the brain correctly, no matter how severe the anxiety is. You don't have to live with anxiety. This earth can be crazy. People can have different opinions. That doesn't mean you have to feel uneasy with you and your life and your situation. Yes, things are hard, and yes, things don't go as planned. That's life. How does your brain adapt to that is the most important, and the adaptation phase happens in here, in the brain, not necessarily just in the emotions. Your balance system How many of you are working on balance? Most of you don't know this, but when you hit 40, it plateaus. Muscle bellies, you probably all know that 26 is your max. But your inner ear balance system peaks at 40. That's why all the athletes, nobody's going past 40 unless you play golf or maybe you're a pitcher in the Major League Baseball. Nobody else is going past 40. There is Kelly Slater. He rocks the world, but that's because he's a surfer. It's different when you're a surfer. But generally, most athletes can't go past their 40. Why? Because they're no longer balancing and challenging their brain. The sport keeps improving. That's why you can't really compare who's the GOAT and who's not the GOAT. You guys know what I'm talking about. So the truth of the matter is, what are you doing to your brain? How are you moving? How are you activating? And we shouldn't be prone to injury. We should be able to move and function every day, all day, at any moment. Go play sports with your kids. Go play sports with a buddy. Go do something, and it should make all the difference in the world. Some of the most important exercises you can do at home is all about balance and coordination. The first exercise that we talked about was cross-curl taps. And that's opposite foot, opposite hand in this manner. You'll try it. Trust me, people will be like, oh, that's super easy. And then they go to do it and they're like, oh, that's really hard. If it's too easy, incorporate your jaw and draw a figure 8 with your jaw. And this will help calm down the brain. Again, if you're ever feeling overwhelmed, you're anxious, you're uneasy, cross-curl taps is the key to helping the brain. And then what I usually take is I'll either have the pad that I'm sitting on or a little Eric's pad. At home, use a pillow, and I always try to challenge my balance. And when I challenge my balance, I'll stand up on one foot and see how long I can go. Your goal is, if you're a golfer, you're supposed to be able to do this for 20 seconds with your eyes closed with not moving your arms, okay? And that's a challenge. I challenge every one of you to get to the point where you can stand on one foot for 20 seconds on an air pad with your eyes closed and don't move your arms. It's going to be a challenge. So at first you'll start and you won't even be able to do it with your eyes open. Then you go to eyes closed. But that's the ultimate goal. If you want to make it harder, don't use shoes. Go barefoot. Again, it could be on a disc that you're sitting on or on a pillow at home. And I would just do each side 3 times. If you're doing this every day, you're going to make all the difference in your balance and your coordinating system.